Okay, so a very warm welcome to everybody who's joined us this evening. We've got a great number, 38 people I can see in the participants, so thank you all for joining us this evening. First of all, I would just like to perhaps do some introductions for our panelists here this evening. So I don't know whether you can see all the panelists on the screen. But first of all, I wonder whether I could come to Dr. Satish to introduce herself first.
Hi, I'm Dr. Nima Satish. I'm a GP at Tor Hill Surgery in Swindon, and I'm the clinical lead for diabetes in BSW CCG. I'm a local GP in being a local GP in Wiltshire as well, and I'm very interested in special interest in diabetes and improving inequalities in BAME communities.
Thank you very much. Pradeep, would you like to come in next?
Hi, good afternoon, everyone. I'm Pradeep Bardwaj. I'm the chairman of Swindon Hindu Temple and a governor at New College, Swindon. As we have all seen, this COVID-19 pandemic has caused unprecedented havoc in our lives and communities. And vaccination, in my opinion, is the single most important tool we have. This is an area which I'm very interested in, and I look forward to contribute to this discussion today.
Lovely, thank you, Pradeep. Steve?
Good evening, everyone. My name's Steve Madden. I'm the Director of Public Health at Swindon Borough Council. My job is very much around protecting and improving the health of our residents across Swindon, and there will be equivalents of me in Wiltshire and also in BAMES. Very interested in the BAME community agenda, particularly around vaccination. We always say in public health, the two key things that can improve health is clean water and vaccines. So for us, it's making sure that we're doing everything we can to tackle the inequalities that are faced around vaccination and improving that uptake.
Thank you, Steve. And Uzo?
Good evening, everyone. I'm Uzo Ibechku, and I'm the chief pharmacist at RUH Bath and at the vaccination site at the racecourse. So I completely believe in the need for vaccination, and as a pharmacist and as a leader of a team of pharmacists, I think it's our responsibility really to make sure that the right information is going out there. We're able to answer anyone's concerns about medicine. And when we do all of them, we make sure that they're kept as safe as possible for as long as possible.
Thank you. And I'd just like to introduce myself. My name is Jill May, and I'm Director of Nursing for BAMES, Swindon and Wiltshire CCG. So if everyone's okay, we will keep an eye on the chat. My colleagues will keep an eye on the chat, but we're just going to start off with a very kind of brief presentation to give you all the context and also some just initial ground rules. So thank you. As I said, tonight is absolutely, we want to get the most out of this conversation because we want to hear from you and we want to learn from you in order for us to do the right things to help and encourage the uptake. But in having this conversation, we just want each and every one of us to listen with respect. If you're not speaking, we would ask that perhaps you could please put your microphone on. We would try our best not to talk over each other, or we will certainly, if you want to come in, raise your hand, we will bring you in. Post your questions in the chat box, as we said, and our team will be keeping an eye on that chat box to answer the questions. We've put here, if there are any technical issues, there is an email address and we will keep an eye on that also. Next slide, please. Okay, we've done our introductions, so we don't need to dwell on this one. The next slide, please. So it's really important that we want to share some of the faces that have attended many sites across Wiltshire and Swindon You'll have seen the sites that range from the Salisbury Cathedral through to the Steam Museum, through to some of our primary care GP premises, or indeed some of our community pharmacists. But I think those of us that have been involved in this, particularly at the very beginning, these were faces that were smiling. I think, Pradeep, you were absolutely right when you said this is something that people could see, that it would start to make a real difference and to start to protect our communities over the next few months. Next slide, please. So, and certainly a lot of the work that Ruth and the team have been doing is that we've certainly gathered some of the feedback from people that attended, and also those that have been part of the vaccination programme. And I think it's fair to say, as we said at the beginning, this is, in the history of the NHS, this is a vaccination programme on the biggest scale that we have ever seen. So those people that are delivering this feel very honoured to be part of this. Next slide, please. So we just wanted to share with you some of the percentage numbers of what's been achieved to date. So the first vaccine started the week of the 14th of December. Great Western Hospital was one of the first hospitals out of 50 across the country to start vaccinating. And I'm really delighted to say that to date, we have just vaccinated over 315,000 people. I won't go into the cohorts because many of you would know it, but I think it's important to say that the first group of people were our older members of our community, where we really felt that they were the most vulnerable. And we reached nearly 98% of that cohort 1 to 4 having had their vaccination. I wondered if at this point I could just invite Steve to come in to just share with you some of the information about the BAME uptake. Steve, would you like to come in?
Thank you very much, Jill. So I think it's really important that we understand our BAME communities across Bath, Swindon and Wiltshire. So just to put this into perspective, Swindon as a borough has the highest proportion of BAME communities. We know in England that roughly BAME communities account for around 14% of the population. And in Swindon, the BAME community accounts for around about 15%. So in comparison to the rest of our population, that's around 33,000 people we have living in Swindon town. Now, the populations across Bath and Wiltshire aren't as high, so I think they account for around about 5% of the population, but still important nevertheless. We know across England that there are over 300 different languages spoken, and in Swindon alone, we know that we have around about 40 languages spoken. So it's really important that we get the message of vaccination out there. As Jill's already highlighted, the vaccination programme has just been monumentous in delivery since we started in December, and we are still unpicking the data now on what the uptake looks like for our BAME communities. I think the key thing to focus on here is in the early cohorts, the uptake has been incredibly high to 96, 98%, which means that we feel that we've very much reached out to those right communities, but not to say that that missing 2 to 4% won't be contacted again. We know, particularly for Swindon, that as we work down through the age ranges, that actually the younger BAME community members are the ones that we need to target, and we're not quite there yet. But as we talk through this evening, we'll give you a bit more of an insight as to what we know we need to be doing and what we will be doing to promoting uptake. I think the key message here is data is coming and we will use that to inform our action, but we won't wait for data to inform our action. The national guidance says that we know that uptake of vaccinations is generally lower across our BAME communities, and we will use the evidence behind that to make sure that we drive forward uptake in those groups.
Thank you, Steve. Next slide, please. So prior to this live event this evening. The team have done an awful lot to get real insights into our communities in terms of some of the concerns that people may have, and we can share these slides with you. But certainly you will see that we know that people are really concerned about the safety of the vaccines. And again, we've got already some questions coming this evening that we can start to answer. There is an awful lot of misinformation out there, and particularly if you're a user of social media, it really is quite sad in terms of how somebody can be influenced over social media around information which actually is completely not true. There's also worry about actually having the vaccine. So again, tonight we can share with you and give you some reassurance about what that will look like. And then there's a great theme coming through about trusting us to make sure that we are doing the right thing and that we have got the right support in place and information, and that we are telling the truth every time. And certainly, I think it's one of the issues is tonight is that is why we want to hear from you. Is there anything else that we have missed in gathering these insights to inform us going further? Next slide, please. So Ruth spoke earlier and has put together perhaps some faith organisations' guidance on vaccines. Again, it's a point of helpful resource, and again, we will share this after the meeting. Next slide, please. One thing that we did very early on was we wanted to have an interview, and certainly here Nabilam Patel and her son, it was her son that brought his mum to get the vaccine, and we were able to hear from her about her experience. And if you go to the next slide, this is what was shared with us in terms of what she felt. And again, you will be able to see that we're able to get different languages in terms of sharing that, so we can share this widely. So she felt, sharing with us that she had a headache and felt sleepy after that first injection, but was fine the next day. And I think, again, as we do the questions and answers, some people have felt absolutely nothing. And indeed, some people have had after the event a feeling of just feeling a little bit under the weather. But again, we will go through these questions through you as we go on. So really, I feel it's really important now we start to go to the question and answer and give you the opportunity. So if we could come off the presentation, please. As I said, Ruth in a minute is going to read out the questions we've had ahead of this evening's meeting, and then we'll be handing over to our panel tonight to ask those questions. We will give everybody the opportunity to come in if there's something in addition to that panelist to add information, and we will keep an eye on the chat with that subject if there's something further to add. So without further ado, Ruth, I wonder if I can hand over to you and we start off with the questions. Many thanks.
Thank you. So can you hear me okay? Yes, good. So the first question we had submitted before the event is, how do you know the vaccine is safe?
Can I answer that, Ruth, now?
Yes, please, go ahead.
Yeah. The vaccine safety has been approved by the Joint Committee. There has been extensive research done on both the vaccines currently available in the UK, both the Pfizer and the AstraZeneca vaccine. There's also an organization called the MHRA, which is the Medicines Health Regulatory Agency, which collects a lot of data. As you know, since December, we've vaccinated millions of people, and there is something called the yellow card reports that have been filed. And these are adverse reaction to the vaccine. And I mean significant adverse reactions to the vaccine. And these have been very, very low. And that is very reassuring to everybody that the vaccines are completely safe. would not have been authorized by the MHRA or the Joint Committee otherwise. The research as well, the numbers in the trials are very large. And now within the UK population, we have plenty of data to suggest that the vaccines are completely safe. And as the previous panelists have said, this is one great tool to navigate our way out of the pandemic. And I could not emphasize enough that they are completely safe and absolutely should be taken up by all people who have been invited to take the vaccine.
Thank you. And the next question we have is, I am concerned that the vaccines were developed too quickly. And if I can hand that over to Uzo and then Pradeep, please.
So thank you. So there are two reasons that I can think of for the speed of the development of the vaccine. So the first is that COVID in our lifetimes is definitely the biggest global emergency that the entire world has come up against at the same time. So effectively, we had to focus all our efforts on finding a way to get to this point where we're vaccinating. So much of the research was put on hold to make sure that all efforts could be concentrated on the vaccine. The second is that although it feels it was developed quickly, the technology for the vaccine has actually been around for a long time. So for the Pfizer vaccine, that mRNA vaccine has probably been around for about 30 years and is already used in many other vaccines. Whereas for the AstraZeneca vaccine, which was the adenovirus vector technology, that has been around for at least 10 years because it was used in the Ebola vaccine as well. So we already had many of the tools to get to this point in place. And credit to everyone involved that all the testing was done. Thank you to all the people who volunteered for the trials, because this has been the biggest emergency of our time. So I can completely understand where the concerns around the speed of development have come from, but absolutely no corners have been cut in getting to this point, going back to what was said in the first question.
Thank you. And Pradeep, do you have anything?
Yeah, I think that's a very pertinent question. I mean, we get asked this question all the time. And actually, Uzo talks about not cutting corners. So he's spot on. We have not cut corners, but actually we have cut the red tape. And if you look, the vaccines, one of the reasons the vaccines have been produced with such a dramatic speed, it's because of the unprecedented globally coordinated scientific efforts that we have seen amongst the experts. And then significant funding has been made available by various governments around the world. That has made a huge impact. And this has allowed the scientists to work at very record speed. And what we used to do in several years, that has now been accomplished in just a few months' time. But we can all rest assured that there has been a very thorough review of whether it is safety or quality or any efficacy aspects for all these vaccines. They have all been thoroughly tested. They have all gone through very robust checks and procedures that have been in place for not just this vaccine, for the last tens of years, decades. All these procedures have been there in place, and they have all been very robustly followed. The other thing we have to keep in mind is if you look at the clinical trials, for example, which is a very, very important aspect. So earlier, what we used to do as an industry is we used to have phase 1, phase 2, phase 3 trials. And all these different phases of clinical trials used to be completely isolated in the sense that you do phase 1 first, then you do phase 2, then you do phase 3. But now what we have done is we have expedited, and we have these different phases have actually been overlapped, and thereby saving a lot of time and bringing in efficiency gains into the system. So I think that kind of gives you some idea. And talking about these clinical trials, Pfizer, for example, was over 44,000 people actually participated in the Pfizer trials in 6 different countries. And if you talk about the local vaccine that we have here in the UK, the Oxford AstraZeneca, that had 23,000 people who participated in the trial in UK, Brazil, and South Africa, and another 40,000 are undergoing the trial for the next phase. So tremendous effort has gone in, and there are a combination of things which can actually point to the speed at which, dramatic speed at which we have made this happen.
Thank you. Do any other panelists have anything they'd like to add at this point? Okay. Our next question is, what about the short and long-term side effects of the vaccines? We don't know about them yet. And that, if I can hand that to Dr. Satish.
Oh, thanks, Ruth. Well, as we know that if you take the short-term side effects, these are often a little pain on the day where you have been vaccinated in the arm, low-grade temperature, you might feel a little bit tired, you might have a little bit of fatigue, and these are usually very short-lived. Rest and paracetamol will do the trick. Now, regarding the long-term side effects of these particular vaccines, as you know, they've only been started use from December, but vaccine usage has a long history, not only in the UK, but all over the world. And the data supports the fact that this vaccine is not any different from everybody would have had the flu jab in the past, they'd have had hepatitis B jabs, MMR jabs, and the vaccine production and the vaccine science underlying these vaccines is not that different. And there's no reason to think that there should be any other long-term side effects. Certainly the data coming out for the 2-month trial shows very few short-term side effects. There were some reports initially in the press about query anaphylaxis reaction. What I mean is a severe allergic reaction. And these were very few, well documented. And as a result, in all the vaccine centers, patients are asked to wait for 15 minutes. And all vaccine centers are well equipped with EpiPens and all the equipment and the expertise to help with any kind of allergic reaction. And these are a very tiny number, less than 1 case per 100,000. So it is extremely safe. And my message would be, please take the vaccine. The only short-term side effects like fever or a bit of arm pain, you need to balance that against the fact that, especially in BAME communities, getting severe COVID, getting admitted to hospital, and the worst case scenario, dying from it, is at least 2 times that of the general population. So it is really worth bearing in mind that if you can reduce the risk of getting severe COVID and getting admitted to hospital substantially, it is really worth taking the vaccine. I've taken the vaccine. I'm going to shortly have my 2nd dose. And I had a little bit of arm pain on the day. I was fine the next day. I didn't have to take time off work. So I wouldn't worry about the side effects when you compare that with the benefit from taking the vaccine.
Thank you. Do any other members of the panel have any comments to add on that? No, thank you. If I can move on to the next question. Do either of the vaccines contain any animal products? And that's for Uzo and Pradeep, please.
I am happy to take this. So in short, no, because neither of them were developed from animal cell lines. Both were grown from, both of the products were grown from cells derived and grown in labs. So that is the short squeeze of it. And neither of them contain latex, neither of them contain gelatin. So they're animal product free.
Thank you. Anything else, Pradeep? You okay?
Yeah, I think just want to echo the point that these 3 vaccines actually that have been approved recently, whether it is Pfizer or Oxford AstraZeneca or the Moderna, in the UK. None of them contain any human or animal products or any porcine products, including gelatin or any animal-derived ingredients. And also, they don't contain any of the common allergens such as latex, milk, lactose, gluten, egg, maize, peanuts. So they are completely suitable for both vegetarians as well as vegans. And in fact, as Uzo rightly said, the way they have been produced and manufactured, they are completely safe and appropriate for all categories of people, whether coming from faith backgrounds or otherwise.
Thank you. And the question that links with that is, and Pradeep, apologies if you answered this, I've heard the vaccines contain fetus, and also I've heard they contain alcohol. And somebody then added, the information leaflet that is given with the AstraZeneca vaccine stated that it contains some alcohol. And there was ethanol, a small amount. Why is this not made transparent when there are a bit normal briefings when people have asked about alcohol? Uzo?
Yeah, I think before I get Uzo, you want to take that on, or?
Yes, so I'm happy to take that one on. So ethanol is contained in many medicines in minuscule amounts, such as this one, as a preservative. Basically keeps the medicine, now whether it's a vaccine or a normal tablet, keeps it safe and almost viable for longer. So as with all medicines and vaccines, this bit was, it was never hidden, and there's a fairly long list of if you like, the non-active products, so they're called excipients, which were made available as part of that same list. And we would always absolutely encourage anyone with any concerns to speak to their doctor about it. So in this case, there's no underhand practice whatsoever here. With regard to the amounts of ethanol, we are talking not enough to actually cause anything, and in fact is probably less than you see in some medicines which have been around and used by all ages for forever. So what I would say there is that yes, it's in the small print, but nothing has actually been hidden. There is no practice that's any different to what we've practiced with the development and production of medicines for a very long time now.
Thank you.
Yeah, I think if I may quickly add, I think Uzo is quite right. I think it's in a very minuscule proportion that it's literally negligible, and it's been around in many other vaccines for last several decades. So it's not happening for the first time. But then I think if anybody wants to see in terms of transparency, I think all these ingredients, whether they are active or not, or they are being used as excipients in this vaccine process, you can find each and every single ingredient and in what proportion they are used. This is on the government website separately for Pfizer and separately for AstraZeneca. And likewise, such information is also available for all the other 270 vaccines that are undergoing through various stages of production around the world. So I think, and if anybody wants any information, I'm sure whether it is Steve or whether Uzo or any of the people from the authorities, relevant authorities, they can always provide the information that we need.
Thank you. And the next question we have, and I think we did cover this partly earlier, is how in the slide, has the use of the vaccine been authorised by the various faith leaders? And we covered that. If there's anything else, Pradeep, Uzo, Dr. Satish you'd like to add, or just happy? Thank you. Okay, thank you. We had one question is, I'm worried the vaccine can cause infertility. And Pradeep, I think you were going to answer that one.
Yeah, actually, yeah. So I can take that. But if I may just, I think on the previous question, Ruth, that you mentioned about the authorization by the different faith leaders.
Yes.
So if you allow me to add a bit or two on that one as well, please. Yes, I think all the different faith groups, you must have seen a slide that Steve presented at the very beginning. On one of the charts, he showed the different faith organizations that have actually authorized and validated the use of these vaccines in the different faith context. So whether we are talking about the Church of England or the Catholic Bishops' Conference of England and Wales, or the Archbishop of Canterbury, or the Chief Rabbi, or the Board of Deputies of British Jews, or the British Islamic Medical Association, or the British Muslim Council, the Mosque and Imams National Advisory Board, Hindu Forum of Britain, Hindu Council UK, and many, many other faith organizations for that matter. They have all issued their guidance and they have authorized these current vaccines that are actually licensed for use in the UK. And they have also clarified on lots of different aspects that people from these different faith communities might actually be worried about, whether it is the use of gelatin, for example, or whether it is the use of ethanol, or whether it is the use of any meat derivatives, concerns around use of porcine products or meat derivatives, which none of these vaccines actually contain. So plenty of clarity has been provided. I think, and if I may add from a faith perspective, I know this is important, for example, in certain faiths that we do fasting. I know Muslims do fasting. I know Hindus do fasting. Buddhists do fasting. So even from a fasting standpoint, they have provided the clarity that, because these vaccines are injected in an intramuscular way, it is okay to take these vaccines when you are fasting as well. So there is no concern around that. And we know that there is nothing to worry, because from a faith standpoint, whether you are taking something in a non-nutritional manner, whether it is subcutaneous way or subdermal, or we have talked about intramuscular, all these things are actually allowed by different faiths, whether it is Hinduism, or whether it is Islam, or whether it is Jewish faith. All these faiths actually allow such vaccines to be taken. Now, coming to the point around the fertility, I'm not an expert, but I would say this. There is this very authoritative body called British Fertility Society and Association of Reproductive and Clinical Scientists. They are very well renowned around the world. And they have issued a guidance to say that people of reproductive age, they should have their vaccination when they receive their invitation, including those people who are trying for a baby. The COVID-19 vaccines have no impact on your fertility, whether it is male fertility or female fertility. And there is no evidence at all, medical or otherwise, that the vaccine affects such fertility aspects. In fact, they say that the myth could possibly have been created because there was an overlap between a very small number of components in the spike protein of the vaccine, of the virus, and in the placental protein. So that is what possibly led to this myth going around. However, they clarified that the overlap was actually too short to plausibly affect any fertility aspects. And they also clarified that if the virus was related to fertility, then COVID-19 should have affected the outcome of pregnancies. And we have seen over the past several months and year actually, that has not happened. There is no evidence around that as well. So I think all these things point to this assurance that fertility is not impacted adversely at all.
Can I just come in on that, Ruth, as well?
Please.
Yeah, the Royal College of GPs and the Royal College of Obstetricians, who is the authorized body in the UK, have clearly come out and said there's no effect on fertility at all. There is no placental proteins or anything similar to placental proteins in the vaccine at all. There have been many similar vaccines, especially to the AstraZeneca one, used in the past, including the flu jab, which a lot of people take annually. and has been widely used for several years. These have had no effect at all on fertility, and there's been extensive studies done on that showing no effect on fertility. The people should rest assured that there's no effects on fertility at all. And this has now been well documented in the large cohorts who've had the vaccine. And there is no basis behind these false messages being circulated on social media.
Thank you. Thank you. The next question, and Dr. Satish, this is for you. What percentage of BAME community have been involved in the trials of the AstraZeneca vaccine and the Pfizer vaccine?
Well, in the Pfizer vaccine, there was about 9.6% African and Black communities, 26% Hispanic, and 3.4% Asian. For the AstraZeneca Oxford vaccine, about 10% Black and 3.5% Asian communities in the original cohorts in the trial. Now, we have to put this into perspective that both these vaccines were tried on a wide variety of populations, not just in Europe, but in South Africa, in Brazil, where there were large mixed populations. And from December, they've been used across the UK. And even though there's the actual percentage population in the studies were smaller numbers of non-white population, this should have no impact on the actual data showing the efficacy, which is undoubted, of the vaccine and how effective it is in reducing the hospital admissions. That is clearly been publicized now last week, and how effective it is in reducing severe COVID hospital admissions and mortality across all populations in the UK. So though the comparative numbers of the actual trial data in non-whites, I don't think that has any effect on the efficacy of the vaccine in the BAME population at all, as has been proven by the reduction in hospital admission and mortality. And this is particularly marked in the BAME population because the data in the first wave of the epidemic clearly showed that BAME community was twice as affected with severe COVID and in worst case scenarios, death with COVID. So I'd say within the BAME population that the vaccines would have double efficacy in reducing mortality and admissions.
Thank you. And Steve, this is one for you, please. What's the BAME community uptake of the COVID vaccine in Swindon and BSW so far, or what do we know?
That's a very good question, Ruth. And as we were talking about earlier, when we saw some of those slides, not all the data is available at local level yet. We were talking about this just before we came live, actually, between myself and Pradeep. And in the time of talking to him and being on the call, I have managed to unpick some of that data. So the government has started to publish vaccine data at a national level as of last week. Looking at some of the data that it goes down to, in regard to ethnicity, it only breaks it down to BSW, so BAME, Swindon and Wiltshire level. So I don't have the finite Swindon detail yet, but we will get there. But just to give you a bit of a flavour for that, out of the vaccines that have already been, the first doses that have already been given, around 80% of those doses, the ethnicity was defined as white or white British. The remainder then seems to imply that 20% has then gone to BAME community residents, but unfortunately a vast proportion of individuals do not state their ethnicity on their NHS records. So although it seems like there's a potential 20% uptake within the BAME community, which would be excellent, actually around 13% of people that have had their vaccine didn't state their ethnicity, which is around about 34,000 people across that footprint. So the key thing here, as we were saying earlier, is we know that historically vaccine uptake across our BAME communities has always been a bit of an issue. So we will not wait for the local level data to make sure that we are engaging with those communities around what we're calling vaccine hesitancy, not just related to ethnicity, but also age and gender play a part. So we know that if you're younger, you're less likely to take up the vaccine. And if you're a male, you're also less likely to take up the vaccine. So we need to take all these things into account when we are working with our communities to encourage them to take up the vaccine.
Thank you. Pradeep.
Yeah, I think if I may add, I think Steve had made some very pertinent points. We have to understand why we have put the BAME communities as one of the high-risk groups. Obviously, we can get hung up about all this, the precise numbers to the last digit. But I think the key underlying message there is that the BAME communities are placed as one of the high-risk groups for a reason. Because if you look at whether it is the high level of diabetes or whether it is heart disease, these are partly to blame, and they are very kind of prevalent amongst the BAME communities, some of the BAME communities in particular. So it is very important that the BAME communities recognize this great risk that comes with COVID in particular, and that they come forward with enthusiasm to take the vaccine as and when they are called upon. Because Nima also earlier pointed out that BAME communities are at far greater risk of developing COVID-related complications and having to be hospitalized for that matter. And in the worst case scenarios, and I have seen with some of my close friends, even deaths for that matter. So in fact, you would recall that obviously now almost a year since we've been dealing with this pandemic, Public Health England made a big study, and they concluded that not just that we are more likely to require admission in an ITU, but we are also most likely to die from COVID once we have been admitted in the ITU. And then Nima talked about some of the multiplication factors as far as risk is concerned. So the Black people are 1.9 times more likely to die as white people. Bangladeshis and Pakistanis are 1.8 times more likely to die, and Indians are 1.5 times more likely to die. And these numbers are not, brought from thin air. They are based on concrete data that we have, that has come across in the last 12 months. So, I mean, I would just re-emphasize the point that, let us recognize these risk factors and go for it. Go for it with enthusiasm, I would say. I have personally taken the vaccine, and I changed my social media cover picture to say that I have taken the vaccine. And obviously, I have experienced firsthand some of the side effects that Dr. Nima was talking about earlier. I think that is not a big sacrifice to make compared to the risk that we may have to go through. That's my 2 cents.
Thank you very much. And Steve, the next one is for you as well, please. Can professional calls be made to members of the BAME communities, similar to those carried out by Dr. Hussein from Newham? She has greatly improved participation through breaking down myths, misunderstanding, and providing trusted leadership.
Great question. Again, Ruth, thank you for that question. So just to tag on to the end of what Pradeep has said there first is, again, when we're thinking about our BAME communities, we know that they are most likely to contract COVID-19, but least likely to take up the vaccine. So we need to very much flip that around. And when we are talking about our BAME communities tonight, we need to be thinking of those broader minor ethnicity groups. So we often tend to think of our Black communities or our Asian communities, but it's much broader than that. We also need to think about our non-white British communities as well. For example, our Europeans that live with us as well. And similarly, other groups that are often forgotten, like our traveling communities, and they all have their challenges, which we need to understand through insight to know how we best engage with them. In regard to reaching out to people, this has already begun in Swindon, and we're working with our NHS partners to do this. So we're working with a very small number of GP practices at the moment to reach out to people that haven't taken up the opportunity to have their vaccine at this time, to understand their reasoning as to why they haven't done so, and to hopefully correct any misinformation, provide balanced information based on the evidence so that people can make an informed decision. Vaccination isn't mandatory. We are never going to force people to have it, but we want to make sure that people are making informed decisions about their vaccination based on correct information. So we're currently working with about 2 GP practices. I think we're about to expand to around 5. And depending on the success of that, we will look to provide a broader offer to the rest of Swindon and hopefully look to expand to Wiltshire and Baines as well.
Thank you. I'm going to start reading some of the questions we've had in, and then panellists, if you'd like to volunteer for answering them. So the first one is, and obviously we're not going to talk about individual people's situations in the call, so some of them I will be generic in how I'm asking. This person's been tested COVID positive in December, and they're also a diabetic, and otherwise they're doing really well health-wise, and they just want to know, will I have developed antibiotics, and does it mean I have to take the vaccine?
So Ruth, can I come in on that?
Yes, please.
Yeah. Regarding that they tested COVID positive in the past, now we know a bit now about how long immunity to COVID lasts. It is probably maybe 6 to 8 months, and this is the talk about, potentially we'll have to have annual jabs, just like we have for the flu jab. So especially if in diabetics, I would definitely say that they need to take the vaccine. The current guidance is if you test COVID positive, you wait for 28 days, and after that you can have the vaccine. If you're symptomatic with COVID symptoms, you ask patients to wait for 28 days. Diabetes is a higher risk category, especially in the BAME community. So I would strongly advocate, please take the vaccine. It's perfectly safe. Just because a person had COVID once does not guarantee lifelong immunity. Often within 6 to 8 months, and especially as health conditions change, the immunity could wane. So yes, please take the vaccine.
Thank you very much. Another question, do we have a choice to choose the vaccination, such as the Pfizer or the AstraZeneca? And is one more effective than the other?
So it's Jill here. I did pop that in the chat. No, there isn't a choice. And the only choice would be if it was based on the recommendation of your GP or consultant. And I think I'd like to pick up here in the chat, there's a few questions around the suitability of this vaccine for a range of individuals. For example, people who are taking steroids or having chemo. We are informed and worked particularly with the Thames Valley Cancer Network in terms of gaining the right advice, particularly around people on chemo. And I really emphasize that we recognize this is a new drug, and in no way are we on this call this evening trying to say it's good and right for everybody. What I am absolutely stressing is at the point of you receiving your letter or your invitation, if you feel you are one of those people that have a health condition that before you access it, please speak to your GP or your consultant, and that discussion can be done on an individualized basis. But also, if you get to the vaccine centre, there is a detailed process in which consent is gained. And as part of that consent, it asks you questions about your health condition, whether you've had the a COVID virus at all. So at that point, at every step, there is an opportunity to make sure you have the right information before you get there. So I recognise the strength in some of these questions. I need to re-emphasise, and Steve and Dr. Satish and Uzo has said, you know, this has been tested and signed off as safe to use, although we recognise we are constantly having a review on what the outcomes of this is. So please, if you're worried about an individual case, get that individual conversation with your GP or consultant.
And thank you, Jill. Does this apply? We've also had a similar one about are vaccines safe for people with HIV and combination therapy? Would a similar answer apply to that as well?
Yes, it would. Yes, you have that dedicated conversation about it.
May I say something about that specific query, Ruth? I would encourage patients to definitely discuss it. There are very specific guidelines sent out to all GP practices about, say, chemotherapy, patients on steroids, patients on blood thinning drugs, and various other immunosuppressant medication. So GPs are happy to have a discussion, an open and frank discussion with you about who would be suitable, and I would strongly encourage you to do that. These guidelines that have been sent out to the GPs are with MHRA as well as the Joint Committee on Vaccination. GPs have something called the Green Book, which gives extensive advice about vaccination, about not just these COVID jabs, but about all jabs. We are used to vaccinating people over the last 30, 40 years and have faced lots of queries about not just these vaccines, but about the MMR vaccine in the past, and we are happy to discuss it. And we'll do that in an open and frank fashion with no coercion, about the vaccine. So, please feel free to discuss this, and we are happy to answer that. I'm sure most GPs and healthcare professionals will be happy.
Thank you. Question we've had is, we're reading in the news about mixing different vaccines in doses 1 and dose 2. Is this being practiced in Swindon as well?
Sorry, no, it's not. Was it round? Are we using the two on the same person?
I could have AstraZeneca as my first one, and my second one could.
So no, at this stage, again, they are looking at this, whether that's possible. But at this moment in time, if your first dose was a Pfizer, your second dose will be Pfizer also. And likewise with AstraZeneca, the second dose will be AstraZeneca. That is why for many residents, we, because of our vaccine supply, at this moment in time, it is a push system. So we are informed of the vaccine coming into the system. We are working with NHS England, and we know on any one day of just what first and second vaccines are needed. So for example, we know in Swindon, we are now starting to commence those second doses. I want to reassure you, we have booked, for want of a better word, enough of the Pfizer to make sure people get that second dosage using that vaccine.
Thank you. Jill, I've seen you've answered this question, but I will read it out if you could answer again for people that may not be looking at the chat. The Islamic month of Ramadan begins around April the 12th. Will there be any adjustments to the vaccination schedules or issues for people who may be fasting?
Yes, and I did put in the chat to say there will be adjustments made for that. So again, part of this evening was to get a sense check of what would be needed, but certainly we will be offering potentially the vaccine before the 12th of April, and also looking at the times in which people would want to access the vaccine potentially much later into the evening. But the most important thing is, one, we recognise that's an important period, and therefore we will be making those adjustments.
Thank you. We've had a couple of questions, and I'm summarising here because some of them are quite lengthy, and obviously with time. It was discussed earlier about the side effects of the vaccines, but some people are aware that some of their friends or family have easily been unwell for 24 to 48 hours with chills, fevers and aches, and concerns that is that normal, apart, where others are just getting perhaps an ache in the arm, and the side effects seem to be differing in different people. So if anybody would like to, panel members.
I'm happy to start on that. So, I think the last thing that we want to do is to minimize or, try and somehow say there are no side effects to this medicine. At the end of the day, it is a medicine, and medicines have side effects. So with every single medicine, you will go from side effects being very common to rare to very to uncommon to rare to very rare. And there is no denying people will have a whole breadth of side effects. So for the vast majority of people so far, it will be a sore arm. I had a sore arm for a week. Some people will have fevers, some people will have other side effects. I've been lucky enough to be the lead pharmacist for two sites, one that's using AstraZeneca, one that's using many thousands of people have gone through both sites. And from first-hand experience and from the view of our clinicians right across the patch, the severity or frequency of side effects is very low and lower than for most drugs. So there's nothing to say that these vaccines are less safe than other drugs. To follow on from that, we all have a responsibility, and part of this bit after a medicine goes, into full-blown use, it's called pharmacovigilance, and we all should be able to report side effects where we feel that they're caused by a drug. So on your AstraZeneca information leaflet or Pfizer information leaflet, there is something about a yellow card scheme. So we would absolutely encourage everyone to report side effects that they feel may have been caused by the drug or may be linked to their having the vaccine, because as a country, as a globe, this is how we build the intelligence and basically helps us care better for other people who may not have had the vaccines. So we are absolutely not minimizing or disregarding any side effects. But as has been pointed out, the if you like, severity of side effects versus the severity of COVID, and with for instance in death, there really is no comparison, and it's effectively a controlled dose. It's effectively a very controlled and a very safe way to prevent the worst impacts of COVID.
Thank you. And the next question is, 23% of health professionals have still not had their jab, and the majority are from BAME communities. Do we know why they are not taking the opportunity to have their vaccination?
Shall I start with this one, Ruth, and then I'll let other people come on in. So again, it goes back to the conversation we've pretty much been having all evening around the dispelling of myths. I'm not necessarily sure that the 23% relates to Bath, Swindon and Wiltshire, but it's something, again, that we're looking at in regard to local data. What we're hearing anecdotally is very much still a lot of that misinformation. I can see through some of the comments and questions in the chat bar there that people are already highlighting that the BAME communities that we have are working in health and social care roles, as they are within broader routine and manual jobs as well. The myth around fertility seems to be the one that we hear a lot. So this is the one that we need to work quite hard with, particularly with our female health and social care workers who are concerned about this. So there's still a lot of work we need to do directly within the communities, but also with employers to make sure that we are dispelling those myths.
Thank you. And one person has said, when we have the Swindon figures, could they see the Wiltshire figures as well? And we'll do that, and obviously with the BAME community. Let me just scroll down. Bear with me, everyone. We've had
Ruth, what?
Oh, sorry, Jill, you.
Sorry, Ruth, whilst you were looking down, I'd like to ask our participants a question, because one of the key things that we're wanting to do is at this moment in time, when you're invited to the vaccine, if you live in Bath, you can either go to one of the PCN sites at the Pavilion or up to the racecourse. And in Swindon, obviously, we've got Great Western Hospital and Steam, just as an example. We were wondering whether there was something about where you get it you would like us to consider, somewhere different, a different part of the town, or particularly the venue. So we know that over the next few months, we are going to have an awful lot of vaccine come into the country, and we will be ramping it up, and therefore we want to make sure that it's accessible to you, but also where else could we be thinking? So I wondered, either in the chat or after tonight's meeting, you would just give us some information about what else we should be considering.
Thank you, Jill.
Thank you.
There's one comment already saying use the various houses of worship. I'm not sure if this one is a comment or an opposite, but regarding blood thinners, precautions, possibility of mild extra bruising and bleeding at the injection site, and blood thinners, if their INR is stabilised and stable vaccination, then it can be safely given.
I'm sorry, could you just repeat that question, please?
Yeah, certainly. It's somebody's commenting about blood thinners, if you're having blood thinning medication, and the precautions of, would there be mild extra bruising and bleeding at the injection site?
Okay, so yes, so mild extra bruising and bleeding is a risk from every blood thinner, regardless of whether you're having a vaccine or not. And it is recognized that with intramuscular injections, which is what these are, that there is a slightly increased risk of bruising. And so that is what it is. It's recommended that after having the injection, the area is pressed down for a bit to dispel as much blood from the area as possible. But once again, that is not unique to this vaccine, and it's as far as I've heard, there haven't been any local reactions based on being on blood thinners. But once again, we would encourage people to report side effects as and if they get them.
So can I just come in on that, Ruth? Specifically regarding a specific blood thinner called warfarin, we would recommend that patients have stable INR, and the patients who are taking warfarin will know what their INR is, because they'll have that done regularly for themselves. There are other blood thinners which are used, which does not necessarily need a blood test like an INR. And then, as I said, if they have any concerns about that, they can discuss with the GP. But all blood thinners, it is like any other standard vaccine, for example, the flu jab, and there could be some extra bruising and a little bit of extra pain in that arm, but especially for people on blood thinners who are likely to have other health conditions causing them increased risk, say heart disease or blood clots, etc., it's really important for them to weigh up the risks of getting COVID and getting admitted. Their mortality will be much higher because they have other health conditions for which they're taking blood thinners. So it's really important to weigh up that risk before worrying that the taking blood thinners will make them more ill with the vaccine.
Thank you. The next question is, somebody's saying that their son will be 18 in a few months. Will he also have to take the vaccine? And linked with this is, what is the minimum age to get the vaccines?
So yes, we will be offering that vaccine obviously over the next 6 months. So if your son becomes 18, we're calling it cohort 10. of which invites for that cohort, which is the rest of the population that are not part of that either vulnerable, clinically vulnerable or older population, he will be invited. You know, yes, he will, and should he wish, and we would encourage it to take up that vaccine. We do know at this minute, anybody aged 16 to 64 within that clinically extremely vulnerable group are being invited. So that is the difference at this minute, where we're inviting 16-year-olds. And again, there is very, very clear guidance offered to vaccinators around those at the age of 16, 17 and 18.
Thank you. And this is more of a comment, but I will read it out. And this individual who wrote it, I will be in touch with you and we'll explain why. I'm worried about the uptake from people my age and younger, i.e. 30. Well, they won't take up the offer when it comes to them. The reason I feel this is because although this person says they will, they know many feel that it's unnecessary, especially given that we don't know the effect on transmission by the vaccine. And I may be wrong. And please help me with the way to address this with my peers. Long-term effects is a concern. So this person, we will get in touch with you because we've actually started in the last 2 days looking at what engagement we can do with 18 to 30-year-olds about their concerns at the vaccine, and we may hold a similar call like this for younger people. So I've seen your message, so yes, we will be in touch with you. And then thank you very much, because you have said, Pradeep, thank you for the invite to this person, and also to the group, thank you for putting this together. So I thought it's an important one to share because it is an area we are going to be looking at for the 18.
Ruth, can I just comment off the back of that?
Please.
So obviously this is an area of interest for us, particularly in Swindon, because consistently throughout the pandemic, the younger age group is where the higher transmission has been. So predominantly that 20 to 24, but actually 20 to 40-year-olds is where we see the majority of our cases. We know that there is a lot of opinion within younger people that actually it's not that transmissible, it's not going to affect them if they get it, and actually the risk of dying is less. We are seeing that reduction in transmission and mortality in our hospitals, but the ones that are there now are the younger people. So we do need to be reinforcing this message. With the vaccine, as the programme increases, we are building our evidence base around how this impacts on transmission. And what we need to be thinking about, particularly as younger people, is it may not be about you having COVID and having weak symptoms or not being affected by going into hospital, but it's the potential that you're handing or passing that on to someone vulnerable that may then have severe symptoms of COVID and then may end up in hospital. So it's always thinking around that. As Ruth has highlighted, there's some stuff that the NHS is doing now to look at building insight, and Swindon is also looking at doing that as well, because it has been consistently younger adults that we have seen transmission in across the pandemic, and we really want to make sure that when vaccine is open and available to them, that the uptake is just as high there as well. Thank you.
Yes, thank you, Steve, and we look forward to working with our colleagues in local authority and other organisations. Question here, somebody's put, people have advised me to take paracetamol before having the vaccine to avoid side effects. Is it correct?
You don't necessarily have to take paracetamol before taking the vaccine. We do advise that after the vaccine, as I said, some people do have a low-grade fever. They could have some pain in that arm. And yes, you can take paracetamol afterwards if you get those symptoms. It's very well controlled, those symptoms, with paracetamol, fluids, and rest. Very few people have actually had to take a day off or anything like that. So I do not think you need to prophylactically take paracetamol before the vaccine necessarily.
Thank you. And this question is, what is the minimum and maximum time between the 2 doses, as I have to plan my travel abroad for some personal work?
So I'll come in there. So the guidance is between the first and the second, it is 11 weeks. That is what we're working to. You'll see guidance about 12, but we're working to 11 to allow for that. If people miss their appointment, we've got a little bit of a window in order to get hold of people. So we are doing all our planning on the second dose at 11 weeks.
Thank you very much, Jill. And the next one is this person saying they're an asthmatic. Will I have to have both flu and COVID jabs every year? And will these be at the same time? If so, have studies been carried out on the safety of having them together?
So I don't know whether anyone else wants to come in.
Yes, we do recommend that asthmatics have the flu jab. Now, the research is going on about the potentially an annual COVID jab, but we really don't have all the data about that yet. And a lot of research is going on, especially with the Oxford AstraZeneca group, looking at the mutant strains of the virus. Just like flu mutates, all viruses mutate, and flu particularly mutates every year. There hasn't been any data out yet about taking the flu jab and the COVID jab at the same time. If you mean, is it going to be a 2-in-1 kind of jab? We don't know that yet. But I would recommend that you definitely take the flu jab as an asthmatic every year if it's offered to you. And this is something that is being developed. We don't know yet, but I'm sure when the guidance comes out as to how the COVID annual jab potentially in the future will be rolled out, we would be asking asthmatics, as you are at a higher risk, will be offered the jab, and the Green Book will put out guidance as to the spacing of doses and the time duration in between doses quite clearly. So I don't think this is a cause of concern now. And at the moment, GP surgeries have been rolling out the flu jab in the usual time frame in the autumn, and we have covered this time even from 50 plus. Everybody was being offered the flu jab, and all asthmatics are offered the flu jab anyway. So that should be taken if possible, if as an asthmatic. There's no guidance yet about an annual COVID jab as such.
Thank you.
Yeah, if I may add from my end user standpoint, I had my flu jab as well. And I was particularly asked when I was booked my COVID vaccine appointment. So you should not have had a flu vaccine within 7 days of having your COVID vaccine appointment. So there should be more than 7 days, just to point out.
Thank you.
And could I just make a point, a bit of a separate point at this moment? So I just raised about the fact that viruses mutate, and viruses mutate effectively when they're allowed to transmit. Viruses can only mutate where the conditions allow them to go from person to person, because they have to live inside a human body. And I guess this is why we do not see a New Zealand strain of this particular virus. And from Steve's point earlier about the younger groups, 18 to 30, if the transmission is higher there, there is every that we might see more strains. And I think this is why there is a collective responsibility on all of us across all ages to do whatever we can to stop the transmission of this virus. The vaccine is not the immediate fix. It is but one measure in all the responsibilities that we have as communities to stop the spread of this virus.
Thank you very much. There's an individual who I think we can get back to separately for their comments they've put, but I will just ask then, could somebody explain how the cold chain works with the vaccinations? We hear about a cold chain being maintained. What does that mean?
I'm happy to take this one. So the storage conditions for the Pfizer vaccine and the AstraZeneca vaccine have been very well if you like, established and have been many times. And effectively, the tests have shown that the the vaccine and the quality of the vaccine stays at a certain level, i.e. what we need, when it's kept at the right temperatures for the right amount of time. And so cold chain refers to all the processes, the quality measures, everything that we do from the point of production and initial storage to the point at which it gets into your arm. So as a pharmacy department, we have records for absolutely every moment of the travel of a drug, from the point that it gets to us, what temperature it was stored at. We're able to show that those fridges have been validated and are fit for use. And so we're able to demonstrate that we've kept the medicine at the right temperature and in the right conditions right up until. So that's what cold chain is.
Thank you. Another question is, will people have had their second vaccination by September?
So yes, that's our plan. So we are looking across BSW that all first doses are finished between mid-July and the end of July, to ensure that then all the second doses can be finished by the end of September. So that's what we're aiming to do.
Thank you. There's a comment being made about the benefits of having vitamin D for the BAME communities. If anybody...
So I can touch on that briefly. So there is guidance out there that recommends the use of vitamin D for all populations, not specifically related to COVID, but it's just something that we would recommend, given that we live in a very grey country between October and March, and I believe that's what the guidance states.
Thank you. I'm just double checking. From what I can see, and if my other colleagues that are behind the scenes, as it were, can you please just check the Q&As to make sure I've covered everybody?
Yeah, so Ruth, I think if I may just make that important point earlier around vitamins. Yes, I think we see, for example, in different communities, a lot of chatter around using immunity boosters and vitamins. I think in the long term, as a general principle in life, which is good, we should have healthy habits. But I think these are not, in my view, a substitute for vaccines. So I think let us not fool ourselves on that.
Thank you. Panel members, Jill as chair.
Yeah, just coming in on that. Sorry, Ruth.
No, please go, please.
Yeah, just coming in about the vitamin D, there have been quite a few studies showing vitamin D supplementation, especially as Steve said before, in the winter months, as people with darker skins have less vitamin D in the winter months, as vitamin D is a vitamin that is made in our skins. And there is a lot of evidence, especially if people are vegetarian or vegan, then there is a vitamin D deficiency can have an effect on immunity. Vitamin D has a lot of effect on many other organs of the body as well. Vitamin D supplementation should be part of a healthy diet, and there have been studies showing that vitamin D supplementation is beneficial. However, overdose of vitamin D, taking excessive vitamin D supplements in very high strengths can cause significant harm, especially to the kidneys. So it should be done with caution and in discussion with GP or other healthcare professional. And as Pradeep pointed out, it's not a substitute for the vaccine. It is a vitamin that's very important for the body, for various organs of the body, and has a role in immunity, but it's not a substitute for the vaccine.
Thank you very much. Jill, I've looked through the Q&A and the chat, and it looks like we've covered everything.
Okay.
To see if anybody feels they go away and they've got another question they ask. For those of you who linked with me beforehand via the engagement email address, then please send it in and we will answer. Our plan is to, this video recording of tonight's session will be put on the Clinical Commissioning Group's website, and we'll make sure that's well known to all of you that attended and other people. And we'll also be typing up the questions and answers so they can be they can be shared more widely as well. And we will send out a short survey to find out how you found tonight. And we will, if we feel the need is there and the request is there, we'll do a further event like this, especially for the younger generation. I think that's clearly come up, and with what Steve was saying as well. So it looks like we've done everything, Jill, and we're getting a few thank yous. Lovely, and I'll hand over to you, Jill.
Yeah, so thank you. And again, I recognise in the comments that some of our participants, and we totally understand that maybe not everything has been answered in full. Some of these issues are complex, and what we don't want to do is to give the wrong answer or the wrong response, because that just opens up a can of worms. So we will still consider these questions and do our very best to come back to you. But we want to thank you very, very much indeed. And if you have found this useful, we really are more than happy maybe to do this again in a couple of months and share further information. And we welcome any response. Email us, contact us, anything. I'd really like to thank our panelists this evening for joining us, being very responsive and very informative. Thank you very much, and we wish you all a very good evening. Last thing, please keep washing your hands, wear your mask, and social distance. Thank you very much. Good evening.
Thank you.
Thank you, everyone.
If the